Well, good afternoon, everybody, and welcome to Cancer Support Community Central Ohio's Lunchtime Learning. My name is Darlene. I'm off camera, but I'm Darlene. I'm the program manager here, and we're very excited to have Cassandra here today talking about Reiki, and then her later in the month being able to provide this program. And so we thought it would be an excellent opportunity for her to share, to give us an education of what it is. So I do not want to take any more of your time, Cassandra. Welcome. Thank you so very much for being here today.
Thank you for having me. Like Darlene was saying, my name is Cassandra Kessler. I'm a nurse practitioner, but I also volunteer. So I've been a nurse practitioner, some background on me, for about 7-8 years. I specialize in urology, and I work with particularly metastatic prostate cancer patients. And that's kind of how I started getting involved, was initially introduced about attending the prostate cancer support group, and then ended up doing Passport to Wellness, which we just had our last walking club. We did it like bi-monthly, and I think we might do one this winter, but definitely we'll be back in the spring if anyone's interested in that. So I'm Reiki 1 and 2 certified. I guess what does that mean? That means Reiki 1 is you are certified to do Reiki on yourself. And Reiki 2 is you're certified to do it on other people. And then there's something called a Reiki Master, which is someone who is able to certify others. It's a teacher. So I had my certification done at Chakra Balance. It is a Reiki center in Pickerington. And that's kind of where I got started with this whole journey. So LJ Groom is the practitioner at Chakra Balance, and at the time, I had known about Reiki from 10 years prior. I went on a medical mission trip to Baltimore, and we worked with a convent. There was a nun that had uterine cancer, and she was going through treatment and was in a lot of pain. Mm-hmm. And while she was an inpatient, someone came to her room and offered Reiki, and she just was all about it. She was saying how it really helped with her pain. And we'll get into what Reiki is, but it's really that placing of hands, that healing touch, kind of calming the body and stress-reducing technique, essentially. But I remember just being amazed. These nuns were really supportive of Reiki, and I didn't look into it any further, but when I was pregnant with my daughter, I was diagnosed with gestational diabetes, which was kind of a huge shock to me. I didn't think I was at risk for it, naively, and with gestational, you need to check your blood sugar like 4 times a day. And you really can see how food and stress impacts your body. If I was stressed out, my blood sugar went up. And I had the diet part down, but I was really struggling to keep my stress level down because I was just terrified. And I happened to remember Reiki, and that helped with the nun that I worked with stress level and her pain, and I looked it up for Columbus, and I found LJ, and she was well experienced. She was trained at the Reiki Center, which is well known, and I noticed when I would go in for Reiki, I would immediately notice for days and days on end my blood sugars were low. They were well controlled, and I kept them controlled without the use of insulin for the rest of the pregnancy, and then I just continued to see her. And I felt like at that point I started to realize that there was sometimes a good blend of that Eastern and Western medicine. Not only looking at the Western medicine of the medical treatments, but also looking at how is your body responding to the stress? Are we trying our best to, what different modalities can we use to reduce our stress in order to keep our immune system up, to help fight whatever issues we're dealing with, such as cancer, which really does rely on your immune system being strong. I just want to preface this too in that this is not in any way like a healing modality, of the fact of like we're not promising cures, and sound therapy is usually called sound healing, but I also am a little bit hesitant to call it that because I don't want people to think we're promising something of, you know, a cure for cancer or other diseases. It's not that, but it is therapeutic. So again, just going over kind of what we just discussed with, and I'll touch on both sound healing and Reiki. So what is Reiki? Talks about, it's pronounced Reiki. It's made up of two Japanese words, universal life force energy. Reiki is a Japanese technique used for stress reduction, I should say relaxation, that promotes healing. So it's administered by laying on hands. There's different types of Reiki. There's two different types, but the traditional type by Usui, that is really like open for all to learn. There was a secondary type that was kind of introduced into the 1970s in the United States. And that one, there were a time where to learn Reiki and to teach it, they were charging people money, which is against what traditional Reiki teaches. But most of us here have been impacted by cancer in some way or another, and you feel that wide range of emotions of stress, fear, sadness, anger, confusion, and I've felt it before, and I'm sure you have, where sometimes you get so stressed you feel physically ill, and you can actually have those symptoms of an illness. So there's research that found participants with a history of PTSD, for example, 58% increased risk of an autoimmune disease compared to those without a PTSD history. There is a book that is called The Body Keeps the Score. And I don't know if anyone's ever read it. It came out a few years ago, but it basically discusses how PTSD impacts people, especially veterans, and predisposes them to numerous mental health conditions, but also physical conditions. And autoimmune diseases are a known, there's a known correlation between that and PTSD. So whole point there is that making sure that you're trying to keep your stress level down is important to giving your body that ability to try and protect itself, again, keep its immune system up. So mind-body connection is what they're talking about in this book. And talked about research has stress on how it impacts the immune system. There's also the energy of intention and affirmation. So Reiki is really intention-based. When you start a session, you kind of go into it saying, what's the goal here? So for example, like my goal a lot of times would be to reduce my stress level, be able to kind of stay in the moment, not worry so much about the future. Well, there was a scientist, Dr. Emoto, that researched how water's molecular structure would respond to these intentions and affirmations. So those energies, and Reiki is a good type of energy work, really. There's actually like physical proof of that, its impact. So these are some different examples of what he found actually in his study, and there is a book about it that goes over, so just giving affirmations of thank you, peace, love and gratitude, you disgust me, and you can see how that affected the molecular structure of the water.
There's a question of, would you put the name of the book in the chat? And I can type that if you tell me again?
The PTSD one?
I believe so.
Because there is one on this, Dr. Emoto's book, The Body Keeps the Score.
We'll put both in, so we'll do the first one on
And
PTS.
I believe the other one by Dr. Emoto, I'll look at it, it's, I think, Hidden Message of Water.
The body
Keeps the Score, yeah.
as opposed to book.
The Hidden Messages in Water is this one, where Dr. Emoto discusses his findings.
Oops. Perfect. Thank you, Cassandra.
Yeah.
I think it's actually the body keeps a score.
Yeah, the body. Oh, thank you.
Oh.
Easy to do.
Oh, okay. I think body is a lot more understanding than the book keeps the score.
Yeah.
Sorry for that confusion.
Okay, so what to expect during a session. First, it's 60-minute sessions. So we're thinking 2 to 4 sessions a month, kind of depending on demand. It would be done here at the community center, and we would be in a room with kind of like relaxing music, usually ocean waves, dim lighting, and you're usually lying flat on a massage table if you can tolerate it. If it needs to be done sitting, we could definitely do that too. We would have a brief discussion on, first I would discuss with you what Reiki is, if you've ever had that done before. Also about sound therapy, if you've listened to like crystal singing bowls, tuning forks, and we'll talk about those. But some people don't like the sound of that. That's really irritating to them. There's no really consistent reason why, so just to make sure it's not going to cause more angst than relaxation. And then discussing what the intention is, like why are you seeking Reiki and what can we kind of focus on or meditate on during the session. So also you'll notice that we talked about just laying on hands. Sometimes it's just gentle touch. So light touch or practitioner's hands maybe a few inches above a certain location. So again, this is kind of energy work, so maybe feeling like, there needs to be light touch on the knees or the feet, which kind of more to ground someone. And so you might feel like that. A lot of times we start with hands on the temple and resting there for a moment. While you're receiving Reiki, you're supposed to think of kind of a happy, relaxing thought. So like I would think about, at that time when I was pregnant, I remember I would think about being at a beach with my daughter when she's an infant and just having this relaxing moment and like at peace with my child, and meditate on that. While the person performing Reiki is also kind of trying to feel out energy-wise places where there might be just light touch. And again, sending like that good energy to you during the session. Benefits of Reiki. So a lot of people experience a deep sense of calm and relaxation. It can help with alleviating pain. That's a big use for it. We have sometimes in the hospital, you'll find volunteers will come through and offer Reiki to patients. And again, you don't have to place hands directly on the patient. It could be above, like, let's say, a broken bone or somewhere someone's having nerve pain. Promotes a sense of well-being and wholeness. Inspires you to look inward, great for insomnia. It is not rude if you fall asleep during a session. A lot of people do, and you can just start hearing them snore. Compliment, if anything. And that's usually also why after the session is done, we'll gently wake you up, have you open your eyes, get acclimated with the room, sit up, and kind of sit there for a minute. A lot of people feel lightheaded afterwards.
So this would really be good then if people are experiencing fatigue along their cancer journey.
Yes, fatigue, I said pain, and I think it's recentering, feeling some anxiety. Any questions about the Reiki aspect? I know that's pretty brief, and it doesn't always make sense until you've kind of gone through a session.
No, but knowing about the benefits is really, I think, pretty important, because we have a cancer experience registry through our headquarters, and one of the top issues that they're finding from our cancer survivors is that fatigue is one of the main issues that's been surfacing. So it's great to know that this is a program that we can promote for people experiencing that.
Yeah, and it's tricky too, because with cancer treatment, fatigue is multifactorial in its cause. It's so difficult to treat. And then also we'll say, okay, well, if you're feeling fatigued, you should probably exercise. That can help fatigue. Well, if you're tired, you don't feel like going on walks. So it's kind of, there's not a good answer for that in most cases. I will say also with Reiki, it's not based in any type of religion. There is no, it's not Buddhist, it's not Christian, it's not anything. It truly is just kind of energy balancing, good intentions, meditation. A lot of it is rooted in that too. And, there can be times where during a session, if you're, Christian, that you can also be praying and praying the Holy Spirit. If you're a different religion, you can be praying for that, in that religion. it's not grounded in any, like a particular denomination.
Excellent. Well, thank you. We
Yeah.
do have a question in the chat. Does Medicare Advantage cover the expense, and does one need the doctor's script?
I have never, you know, the Reiki practitioners that I've known, it was all, you know, private businesses. I am not sure. That's a good question, and I can find out. Of course, the Reiki that would be offered here would be free. And I do know a good amount of, you know, Reiki providers that would do this for free and volunteer. But I don't believe that it's anything that would require a script. And I don't think that they go through any insurance companies that I know of, but I can find out. Yeah.
Thank you.
Okay, so sound therapy or sound healing, that can be incorporated. It's incorporated now in acupuncture, different meditation, yoga, but sound is traveling waves of energy produced when something vibrates. It was used by ancient cultures. The didgeridoo in northern Australia, it was used there. So this is not a new concept. So with sound healing or sound therapy, what does a typical session look like? It's something that I integrate into Reiki. If you're not comfortable with Reiki and you would prefer to have just sound therapy, you could do that alone. With sound therapy, you use tuning forks. And I have a picture posted. I also brought a case here, but with tuning forks, there are ones that are weighted that you kind of hit against the palm of your hand. They produce a vibration, and you put it on different points of the body. It's very soothing, but it also is to help kind of align the energy of the body and balance it all out. Then there are non-weighted tuning forks that you'd hit and hold up to the ear. Crystal singing bowls are another one, and you've probably seen those. We'll go on to it. But I'll say on tuning forks, may reduce stress, muscle tension, pain, muscle spasms. And sound therapy and Reiki are non-invasive, not affiliated with any religion. Simply bringing the mind, body, and spirit into balance. Again, 60-minute sessions. And that would be the same even if you wanted sound therapy. If you wanted it a little bit shorter than 60 minutes for sound therapy, we probably could do that. Some people do feel some like GI upset afterwards, which is really interesting because, and they'll say maybe it's potentially like kind of purging of like bad energy, anxiety, stress. So I've had some patients or colleagues actually that have done sound therapy, and they had some trauma history, and after doing the sessions, they were, for like several days after, they'd have some GI upset, and then they felt great. But that can happen.
So we do have two questions in the chat.
Yeah.
I have other health issues other than cancer. How do we find out reliable practitioners? Is there like a website or a resource guide that talks about local practitioners?
For like healthcare providers for the other medical issues, or for Reiki specifically?
Oops, wrong button. Gail, you're welcome to
health issues.
unmute and answer that, or put that in the chat as to which practitioners you're looking for. Oh, I'm sorry, we're not hearing you, Gail.
She's got to unmute.
Yeah, she's not muted.
Well, I'd say, if we can't hear you, Gail, I'll try to answer your question best I can. Depends. If you're looking for a certain medical reason, I usually will look up, people who specialize in it, and on the websites, it says their training. I would look at their training, like where did they have their residency at? Did they have a fellowship that's specialized in what you're looking for? Sitting down and reading the reviews. I don't think that they're always accurate. People are much more prone to complaining than they are to say something when something positive happens. I guess that's just human nature. But you can get a general idea if it's going to be a provider that wants to take their time with you, answer the questions thoroughly, and knows what they're talking about. You usually can get an idea. And there are a lot of different magazines, community magazines, that will review surgeons, like best surgeons in the area, best providers in the area, and that will kind of give you an idea as well. So there's different sites that you can look up to see the reviews. I would just kind of carefully go through that. It's harder to find certain ones, so I mean, if you Google it, there are numerous. I wouldn't say there's one in particular that I would back up, to be honest. I think like we just were notified some of our physicians were nominated in Columbus, I don't know if it's like Columbus Magazine, for like their top doctors for
Oh, nice.
like 2024, and they'll have each specialty will have their different physicians that they were nominated. And I will say, the physicians that were nominated from our office, I absolutely would send a family member to, and I have. So there are a lot of times those are pretty accurate. But yeah, that would be my best advice. That's a tricky question, but a good one. Are there any other questions I can answer? Yeah.
When does this start here?
So it should be this month, is what we're thinking, later, at the end of this month.
Yeah, in fact, I have my
Do you know
calendar.
what day?
I have my calendar, because, and Cassandra and I are, because the original date that we had set is no longer viable. So we're gonna be figuring that out as soon as the session's done.
Yeah, I know. I
And-
have a
and
friend
this-
who's a Reiki master.
Yeah.
She keeps telling me to go to the library and start reading on it. Yeah, and she's done a sound therapy, and she said it really works. I mean, she's very pleased,
Yeah.
and she actually is a Reiki master. But yeah, I'm very interested in it.
Yeah,
Definitely.
and I believe Cassandra may have referenced this earlier, but because of the time is limited, being a full-time nurse practitioner doesn't give her a lot of time to drive across town and give us time. So we're gonna start with survivors only.
Okay.
So it's actually gonna be called Reiki for Survivors. And then as interest grows and we'll see if the schedules are aligning well, we might open that up. But right now, we're doing just
And
survivors.
does it help with neuropathy?
It should, yeah,
Yeah.
I would think with that pain management, yeah.
yeah, definitely. I think, like I said, it's most helpful, I think, for, yes, pain management,
And insomnia, that would be wonderful.
insomnia, yes,
Yes.
yes. And I've heard many people say it before, I've experienced it where you get your best sleep after a Reiki session, I think, because you're so relaxed.
Yeah, I've had acupuncture before, and it was really good, too.
Yes, yeah, it is. And also with, you know, the sound healing, I should add too, and the crystal singing bowls. I don't know if people have heard about sound baths. That's really picking up in Columbus. Different meditation rooms or yoga studios are now holding these sound baths where it's essentially like a group of people with the crystal singing bowls. And someone is playing the singing bowls and everyone is just meditating, and you're bathed in sound.
It really works. I know, she was telling me all about it.
Yeah.
Thank you.
Yeah. Yeah.
I just, personal experience, after I had uterine cancer, but we also have a lot of colon cancer in the family. So I had gone in for a colonoscopy, and the next day I had the surgery to remove everything. And they, looked everywhere, so I had stitches, 42 staples. And then developed colitis, because my body just said, you're done. So a month later, I'm still, they couldn't do anything to keep me from running to the bathroom every 45 minutes. And I went over to a friend's house to pick up my daughter, and she said, well, do you want a Reiki treatment? And I was like, I didn't know what it was.
Yeah.
And I'm like, anything. Laid down on the couch. She didn't touch at all. She was, above everything. And I was vaguely disappointed that there was no massage involved or something, I'm like,
here's your pain.
yeah. It was like, okay, it was nice to relax for a little bit. There was a part of me that was worried about being there too long and not getting to, what if I have to go, kind of thing.
Yeah.
But I was fine. and she was finished. I'm like, cool, thank you. I mean, it didn't really dawn on me one way or the other. I mean, it didn't seem to be a huge thing. And then I drove home, and I was fine, and I was fine all afternoon and all evening and the next day, and it was like, wait a minute, I feel fantastic.
Yeah.
And, I mean, it did come back after that, but it was like I hadn't had any kind of relief,
Yeah.
for a month, and it was very, very nice. I was kind of like, okay, yeah, there's something to this. And
Absolutely.
that was kind of going to it with, I don't know, and being pretty skeptical of the whole
Yeah.
process.
And that's okay
Yeah.
too, to go into sessions feeling skeptical.
Mhm.
We just usually ask, of course, like an open mind to it, but for the most part, but yeah, I will hear those stories. And I think it does have just allowing the body to relax and, again, feel balanced in order to try to heal itself. So the sound bath, that was an idea about doing that for a group. I guess it would depend on discussion about what the interest would be. But that definitely is possible. Yeah. There are some other Reiki instructors, there's from Chakra Balance in particular, that are interested. So we may be able to do and offer more, having more volunteers for this. Yeah, and I think the Reiki instructors kind of give, I guess, like a average. If you go to an outside Reiki instructor, there's several that are phenomenal in Columbus that I just am familiar with. I'm sure there's more. I think the rate for a session normally is about like 70 to 75 for an hour. I would not be paying more. It would be more with sound therapy involved. But that should be around the average.
And Karen, yes, once we have those dates nailed down, I will tell it'll be on our website, but then we'll also, for those of you who have attended today's session and are survivors, you'll get first knowledge. We'll let the Lunchtime Learning participants today know about them first, and then we'll be putting that out in email and on our website. Oh, I'm sorry, Gail, I did put it in the chat for you to find somebody reliable, as Cassandra was saying. If you can Google Reiki instructors, but she was also saying that when you're looking at rates, that it should be around $70 a session.
Yeah.
Just be very wary, being aware of places that charge more than that. And I will have to say, right before I had a conversation with Cassandra and her telling Angie and I that she's certified, I had reached out to the Reiki Center to have them come in and do a lunchtime learning on Reiki.
Oh, really?
And then within 2 days, I got your email saying, hey, I'm certified.
that's
I'm like, well, I'm
weird.
gonna hold off on that.
Yeah.
And have you do that presentation. So we do know that there's instructors out there. You just wanna, just do your due diligence, look at reviews, and look at how expensive the sessions are.
Yeah.
I'm sorry, Gail, we're still not hearing you. I can see you talking, but we're not hearing you. You can always give me a call after this session, and I'll be happy to talk with you about this. I'm sorry that the audio is just not working for you. It'd be so much easier. But technology sometimes rears its ugly head.
Oh, that's neat, so.
Oh, Melissa said in the chat that the Reiki Center offers a free monthly clinic with mini sessions. That's great to know.
Yeah.
So definitely check in the Reiki Center.
Yeah. And I think there's the Reiki sound healing. I think there's like maybe it's Sound Room in Polaris area that offers it. The only people that I could find personally was someone named Joni Good that is out of Chakra Balance in Pickerington that does the sound healing. And that's who I was certified through. And then like I said, I think there's a business out of Polaris that does it. Reiki Center is in Grandview. And they've been around forever. So they have a good reputation.
Thank you for that information, Melissa, that the next session is on the 21st. It's good to know. Any other questions for Cassandra? Well, Cassandra, we wanted to give you a thank you gift to enjoy some of our Crimson Cup coffee and tea.
Oh, I can always take more coffee. Thank you.
So thank you so very much for
Thank
coming
you.
out today, sharing
Yeah.
your expertise with us.
Absolutely.
If anybody finds they have questions later, you are welcome to contact me, and I will forward those on to Cassandra, and then she can answer, and we'll get that information back to you. But thank you again so very much.
Absolutely.
Well, everybody online, you'll be getting a Survey Monkey from me to do an evaluation.